Thanks, Sarah. Thank you, Dr. Crane. So I neglected to mention a few things I realize now in my opening. One is that for folks that are on the webinar, there are some attachments in the file area. Please feel free to download those. Those are the handouts that we have here in person. For folks that just came into the room, please feel free to come up here at your convenience for handouts, sign-in sheets, name tags, also coffee, water, and soda on the other side of this wall. Help yourself whenever you need it. And probably the most important announcement for folks that are in the room, there will be lunch, and that will be coming at noon. So I think that was a really nice overview. I think where we wanted to sort of frame the day is with the breadth of the recommendations from these national and global organizations in terms of viral hepatitis surveillance, prevention, and treatment. So to give you a little bit of an overview of everything today, so first of all, I think we need to thank a lot of people. We have a lot of our federal grantors that are on the webinar today. ASTO, the Association of State and Territorial Health Officers, are the ones that really provided the funding for today's meeting, and we really thank them for their assistance in that. MPHI are the folks that are hosting us today and have all this great audio visual stuff. For folks on the webinar, please, every hour or so, just give us a thumbs up on the chat. Let us know that things are working how they should be. Of course, we have a lot of guest speakers today, and we really appreciate them coming and participating with us, and all of you for coming. We know that we have a really diverse audience of people here today. I know we have pharmaceutical representatives, we have clinicians, doctors, nurses, community health centers, public health, epi, laboratory, really the whole gamut here. So I think that's really great. Of course, what we're going to do is going to be providing a lot of data. That is what we do in our group, and so, and a lot of the data that we're showing today is from our disease surveillance system, but we also supplement that with a lot of other data sources, and so we're thanking those people as well for helping us out in getting access to various data systems. As far as the viral hepatitis data goes, most of it is collected in the Michigan Disease Surveillance System, which is really data that's collected by our local health departments. They're the ones that are really responsible for doing the case definitions, case investigations, calling patients with new diagnoses. So a lot of this couldn't really be possible without their efforts, and we thank them for that. And of course, our group, Kim Kirky unfortunately is on vacation and couldn't be here. I mentioned Charday has been out for a few weeks, unfortunately, but myself and Adam and Marjorie are here to keep moving forward. So I think one of the purposes of today's meeting is of course to share data. So we have an annual surveillance report that we will be releasing very shortly, and we'll send that out to everyone electronically and have that on our website as well. But we really want to highlight incidence, prevalence of hepatitis, but also the morbidity and mortality that's associated with it. And really connecting this data to the frontline staff, what you guys are doing in your communities, in your settings, and just to have an open kind of forum and discussion for all the people that viral hepatitis impacts. And so I think I might have this on the next slide, not quite, but we have a pretty packed agenda. The idea was to show, we have really kind of a bunch of different episodes as it pertains to viral hepatitis today, and the things are linked by that sort of commonality with hepatitis, but we think they're really quite diverse presentations, so I hope you'll find that interesting. Again, we don't have a lot of breaks in the agenda, and I think that's just to sort of accommodate our folks that are on the webinar, so there's not too much dead time, and there will be a couple of substitutions potentially on the agenda today. So the major topics that we wanted to cover, of course, hepatitis C and the relationship to the opioid and heroin epidemics, which are really impacting all over the state of Michigan. Morbidity and mortality, particularly in relationship to hepatitis C, without improved efforts to screen, link to care, and treat individuals who are chronically infected. We do have an outbreak of hepatitis C that's been occurring in the HIV-infected men who have sex with men population, which I think will be sort of an interesting thing to talk about in the afternoon. And of course, we always want to make sure that we don't forget about hepatitis B. It is maybe not as big of an issue domestically as it is internationally, but it still has a lot of morbidity associated with it, and really important prevention strategies to prevent mother-to-child transmission that are, of course, are important to highlight. And I also want to say that this is the table of contents for our annual report, which will be coming to you shortly. This is the tip of the iceberg, the stuff that we're covering today. There's a lot more in this report and things that we're just not able to cover in one day. So I just want to make sure that you're aware of that. Just a couple technical notes. So our group focuses mostly on hepatitis B and C. There is a pretty significant hepatitis A epidemic going on in Southeast Michigan that everybody should be aware of. It's not something that our group is responsible for investigating. That's mostly our enterics group because of the association between the route of transmission. We do hope to have some folks coming this afternoon that might be able to speak to that a little bit more in the open discussion section. And I do want to point out that MDSS is really designed as an incident disease surveillance system. So the data that we're reporting on today is largely new diagnoses, and we do not get negative lab results reported into our system. So tracking patients' viral clearance and things like that is tricky with the system the way that we have it set up right now. But we'll do our best to sort of highlight some aspects related to clinical management of patients. And I just want to point out that we follow all national reporting standards. So we're using standardized case definitions, standardized reporting forms and case investigation forms, deduplication of cases and things like that. Just to give you a sense of the number of labs and patients that get reported to us each year. So in 2016, we had over 31,000 unique individuals that had a hepatitis C lab reported to our system, but really for approximately 12,000 new diagnoses. So a lot of the labs that we're getting in are patients that are chronically infected that we've already known about. And I do also want to highlight that acute diagnoses are, again, they're asymptomatic in many instances, difficult to diagnose, and we do see them, but they're not as common. So we really feel like performing surveillance for chronic infections is really important. There's a lot more data there. A couple of things I think we need to highlight as we go through some of the data. The first is there was a pretty major case definition change in 2016 for hepatitis C. So you will probably see in some of our data that there has been an increase in cases between 2015 and 2016, which may be partly responsible for that change in the case definition. Also in our annual report this year, we switched from using 2010 census data for our denominators to using 2015 census estimates. So if there are changes to infection rates, it may be the result of us changing that denominator and not necessarily a change in the numerator. So just keep an eye out for that. We do plan on putting all of our presentations and the recording of today on our website, michigan.gov/hepatitis. Please visit the website even if you want to, anytime you want. Lots of good resources on there. We hope to formally release the annual surveillance. We have to make a few tweaks to our annual surveillance report still, but it will be hopefully coming out in conjunction with the press release on July 28th, which is World Hepatitis Day. As far as the setup for today goes, again, we do have a pretty tight agenda. If there's time at the end of the presentations, we're happy to take questions, comments, either in the room or on the webinar. But we do have set aside some time this afternoon, at least a half an hour, I think, for just open discussion. So if we can't get to questions within the time frame of the presentation, we'll definitely circle back to them at the end. Okay, thanks again, and welcome.